Good morning, good morning. I know we have been waiting for this day, and we have many friends in the room, and you have a lot to talk to, and we've been looking for this day for a very long time. We're getting together, and we are about to start the 15th annual Les Turner Symposium on ALS. Thank you so much for being with us today, and we have also many people joining us from their home. Now, this event has both in person and also in Zoom format, so that patients can join with the comfort of their home around the globe. We have many participants joining from many different countries. So even though I say good morning, maybe I should say good afternoon, good night. And whatever your time zone is, you are all welcome here. Thank you so much for joining us. And I don't know if I will be able to move my slide. I hope I will, and I was able to. That's great. So I want to give you an update on, or some information about how this all started. It all started with love, friendship, and care. Because when Les Turner was diagnosed with ALS, he was a very young businessman. And at the time, there wasn't really any resource or information about this disease. And his friends and family got together and founded the Les Turner ALS Foundation in 1977. This is one of the first foundations established in the United States about ALS. And Wendy Abrams was the executive director, and most of the achievements that we see today is thanks to her vision and tireless efforts. And the vision was actually to bring people together, because this is a very tough disease, and to create a support and a caring environment so that patients will have what they need at one spot. And then they also wanted to lay the foundation for a brighter future for the patients and also the scientists. I joined later to the foundation, and immediately after I joined, I realized that to bring people together and to form a community, it is important to establish symposiums, because symposiums are the places where people come together, they exchange ideas, and patients also learn from the scientists and learn about the achievements that is taking place. So the first one we actually had in 2011. And since then, there has been many changes here at Northwestern and also around the globe. But the Les Turner ALS Foundation did something remarkable. They did not only wanted to help the patients, but they also wanted to establish a research lab investigating ALS. And that was done in 1979. And even though it was Dr. Burke at the very beginning, then joined by Dr. Siddiq. But in 2014, something remarkable happened, and that three labs, Dr. Siddiq's lab, my lab, and Dr. Kiskinis's lab, formed together, and that was the initiation of the first center. But now, 2025, with the leadership of Dr. Bob Kalb, and he will be giving opening remarks after me, under his leadership, now there are more than 20 different faculty and more than 79 researchers, and our family is getting bigger and better. So the symposium first started looking for the effective treatment strategies in neurodegenerative diseases. We picked a topic and we tried, even looked at the common pathways between ALS and cancer. Then the university said, this symposium is actually doing well, and then they started helping. So then we had the 4th annual symposium with Brian Traynor, the 5th with Kevin Egan, 6th with Terry Hyman Patterson, 7th with Christopher Henderson, 8th with Merit Skovich, and 9th with Eva Feldman. tent with Sabrina Paganoni. And, the list goes on. And each year we invite a keynote speaker who has done a tremendous amount of work and achievement in the field. And we also have a science session in the morning. Then we also have a clinical session in the afternoon. We have poster sessions, and this time we actually have more than 30 poster sessions. And we bring patients, families, scientists, researchers, and now even drug companies together under one umbrella. So we had Dr. Maragakis, Dr. Brown, Frank Bennett join on the 13th, Angela Genge on the 14th, and now that brings us to the 15th annual Les Turner Symposium. And we are very humbled and honored to have Don Cleveland with us in the room and as our keynote speaker. We are very happy for his presence. Most of you know Don Cleveland, and Dr. Kiskinis will be introducing him, but I would like to say that I think he may get a Nobel Prize. That's my opinion, but because he's the one who actually identified the ASO treatment strategies. And we have an amazing team of scientists with us today. Some came all the way from Canada, some came from London, and we have our local scientists, and at our center, also in Chicago, putting together a very nice program. So I hope that you enjoy our program today, and we have registration from all around the world. We have 31 abstracts, and I think our symposium became one of the local and global symposiums that are making an impact. And of course, nothing of this could be possible without our sponsors and people who support us. Mesulam Center has been with us since its inception. And Dr. Vassar is here with us, and Dr. Mesulam was our first speaker, so we are very thankful to the Mesulam Center. And Mitsubishi Tanabe, Biogen, New Motion, Baxter, and Akava Therapeutics are with us today. Some of them have tables outside. Please go visit them. If you have any questions, you are welcome to ask them. And welcome to the 15th annual Les Turner Symposium on ALS. Our goal is to become friends. Our goal is to start new collaborations and foster new ideas such that what we find, what we discover will be translated into effective treatment strategies. We have everything that we need in this room. It is our ability and our obligation to connect the dots so that patients will actually live a better day. So with that, I want to thank you for your attendance. Thank you for coming. And I want to introduce Dr. Robert Kalb to make his opening remarks. And Dr. Kalb is the director of Les Turner ALS Center, and he's the chief of neuromuscular disease, and he's John and Paul Rupschlager Professor of Neurology. Dr. Kalb.
Okay. Thank you. Thank you, Hande, for your devotion to this project over a very long period of time. We all take our hat off to you and say thank you. I'd also just like to mention, let's give her a... And also Rachel Adler has been a superb executive assistant, administrator who's been putting it together. And so let's give her some. Can we take my face off of here? It's a little frightening. Okay, so I'm just going to make a few comments. These are my personal views. They do not reflect, or nor have they been sanctioned by the Les Turner Foundation or the Feinberg School of Medicine. It's just my personal feelings. I believe it is healthful to exercise regularly, have balanced, nutritious meals with vegetables and fruits, get enough sleep, sunshine on your face. I think these are good things. Personal view. We live in interesting times. Dr. Casey Means has been nominated to be the next Surgeon General of the United States. That job is to guide Americans on matters regarding health. Dr. Means states in her recent book, "Trust yourself, do not trust doctors." Her book promotes the idea that Stanford University and other elite institutions are fundamentally corrupt. She believes that doctors make patients sicker. I view this as a broad assault on science. And one palpable piece of evidence in support of that is that the National Institute of Health has stopped sending money to leading institutions, including Northwestern. These are grants that have been approved, that have been funded, they've been vetted, they've been funded, and the money has stopped arriving, okay? So for 8 months, the university is picking up the tab. I just want to let you know the circumstances under which we're living. Science has been called an efficient path to the truth. This is the method. You come up with an idea or a hypothesis, you test it, either you reject it, or if you don't, you see if you can build on it. That's how the system works. It's not a straight line. We make errors all the time. We decide that this is a direction to go. It turns out to be wrong. That's the way science works. ALS and frontotemporal dementia, which are diseases on a spectrum, are difficult problems as decades of research have revealed. Some have said that we lack a cure because we don't really want one. Or we have one, but we don't want to make it public because we want to figure out a way for the pharmaceutical companies to make money on it. Balderdash. Baloney. The Les Turner Foundation, the Les Turner ALS Center is one of many academic centers that work to find the cure to ALS and FTD. We undertake the highest standards of clinical research, of patient care, from observational studies to double-blind placebo-controlled phase 3 trials to wet bench science that is focused on finding answers. We are a leader. We are science, and we are here. I just want to say, in closing, we have an absolutely fantastic set of speakers that are going to present today. These are really leaders in the thought process of what's going on with ALS. It's a complicated problem. We can find the answer. We just need to put our shoulder down and continue to work hard to find the answers. And I think that we will. So I'm going to turn it over to Evangelos to introduce the speakers. I'm sorry. One last thing. Dick Durbin, the senator, the 5-time senator from Illinois, was going to present today a brief statement about his support for ALS. Unfortunately, this got caught up in the federal government shutdown, and he was unable to visit or to create a video or to provide the letter. I just want to say that Dick Durbin has been a great champion of fundamental basic science research in the ALS space, as well as many, many, many other reality-based endeavors. And we thank him, even if he couldn't create a statement today.
So it's my honor to introduce Evangelos Kiskinis, and he will be moderating the morning science session. And Evangelos, it's a happy moment actually, because he's a friend, he's a colleague, and he's a good colleague. Evangelos has done tremendously in the field of iPSC cells, and he's directing a center here as well. And he's an associate professor of neurology. He's well connected, he knows everyone, he's friends with everyone. I think it's time that you become friends with him as well. And thank you, Evangelos, also for inviting our speakers and helping with the program. And please take on. Thank you.